Hi, welcome to the Fit and Healthy Today show. Today our topic matter is on lupus. Had a lot of people coming in last week with lupus diagnosis from their doctor, and I thought it would be a helpful thing to identify perhaps some of the causes. The symptoms are pretty clear, at least to those who have it, but for those of us who don't, to kind of give you some idea of what to look for, and then some of the supplements and diet that may be helpful in the treatment or reduction of symptoms of lupus. First of all, lupus is an autoimmune disorder, and in all autoimmune disorders, what happens is the body has a difficult time identifying friend from foe, and so it'll attack healthy tissues, causing inflammation and pain. Now, the problem with lupus is it usually arises in age 40 and later, so we sometimes think that maybe there may be some hormones or something related in that regard, but women age 40 and above, 90% of the sufferers are women, not men, and you are 3 times more likely to sustain lupus if you're an Afro-American woman or a woman of Afro-American descent. There's 2 different kinds that we deal with. One is just more inflammation, red skin across the face, and you'll see it sometimes additional on the forehead and scalp, and they'll have this kind of red kind of look to it. Now the systemic is the same as above, but literally the tissues, the body attacks tissues in the joints and muscles, and it creates very similar pain to like rheumatoid arthritis. Now there are tests that can be done for this now that are much more accurate than the tests that were in the past that can check for particular antibodies that seem to be more prevalent in lupus. Much easier to diagnose. Now when we're talking about symptoms, it's interesting because they vary from person to person depending on what body part is being attacked and what overall physical condition you are in, your hormones, your diet, a lot of different things. But the most common symptoms, besides the red face and the attacking of the joints and the muscle tissues, are fever, fatigue, weight loss. You get very sun sensitive, so the areas that are red across the top will take on like a burned type of a look, and if you are in the sun, it will burn much more readily. You're susceptible to other diseases because your immune system doesn't properly respond, therefore it can trigger your body can't identify from foe properly. It can enhance other diseases such as cancer and other viral and bacterial types of infections. We also see a continual reoccurring of bladder infections because once again, most of which are bacterial caused, are difficult for the body to identify. When we look at the causes, there's not any one particular cause that the medical establishment has been able to say this causes lupus. But we have to kind of look at who the lupus is attacking, and it's generally, like I said, women age 40 and above. So when we look at that, you got to kind of wonder if there isn't some type of hormonal type of thing going on here. We've got such an estrogen dominant and progesterone deficient environment. We've got all these xenoestrogens from pesticides and plastics and herbicides and fertilizers that us women end up being extremely what are called xenoestrogen dominant. And so as we go through perimenopause or menopause, our progesterone levels fall, so therefore it makes us much higher ratio of estrogens to progesterone, which we kind of wonder if that isn't one of the contributing factors to this particular disease. We're not sure whether or not viruses, bacteria, or parasites might be the trigger. There was some research on something called black walnut hulls, and it was found to be in folklore a quite effective treatment against lupus. So it makes you wonder, and since black walnuts we typically use to treat parasitical infections, you kind of wonder if maybe that may be a contributing factor in addition to all these xenoestrogens causing so much inflammation, RNA, DNA damage. Now, chemicals as well, which are not necessarily just estrogenic, but alter and change our RNA, DNA, or affect our immunoresponse, I believe could also be a contributing factor as well. Heavy metals, boy, nervous system response, immune system response, and I'll tell you that good old fluoride that everybody seems to be trying to push on everybody to strengthen teeth, which actually, based upon some of the research Ralph has given, actually cause your teeth to crumble. Mercury from the fillings. I had mercury poisoning from my fillings starting to leak after 30 years after they were put in my mouth. Anything that seems to cause digestion issues or digestion problems, gluten intolerance, food allergies, anything, remember 80% of your immune is down in your bowel. So therefore, if you've got diverticulosis, diverticulitis, IBS, digestion issues, heavy metals cause digestion issues, food allergies cause digestion issues, your immune system is not going to respond in a proper fashion. So that can be a contributing factor. Deficiency of hormones, I already addressed progesterone, but there are other hormones that these xenoestrogens can block, including DHEA and testosterone, particularly in males, or contribute to a conversion of testosterone into dihydrotestosterone. And then constipation and diarrhea. When a person has a constant issue with not being able to properly detox or eliminate, and probably that's what I probably should have said here, you hold on a lot of toxins, your body doesn't get rid of them, and guess what? Your immune system's not so good, you become toxic, and you become vulnerable to all autoimmune disorders. When we look at diet, now I should just photocopy because it seems like the diet is just about the same for just about every disorder, and so therefore, really take this to heart. And later on in the second part of the show, I'll be mentioning some different types of salads and things that you can use to help detox the body with. But when you're talking about diet, it is very, very important when you have lupus to go organic. And through the literature that I researched and read throughout the last week, the organic, because no chemicals, no pesticides, herbicides, petrochemicals, no chemical. You want to go as much chemical and toxin free as you possibly can anytime you have an autoimmune disorder. So organic fruits and vegetables high in fiber allow you to eliminate. They also give you nutrients, oxygenate the blood, alkali the blood. And that was a big issue too as far as lupus is concerned. Oftentimes people are extremely acidic. Their bodies ache and hurt. Their face aches and hurts. And when you have those issues of inflammation, anytime you have an acidic diet, sugar, flour, pasta, starches, the kinds of things that I have on here that you want to eliminate, you're going to get acidic. So alkaline fruits and vegetables with primarily plant-source proteins with lupus. Now there are some studies out on lupus with animal-source proteins, and we already know animal-source proteins can, other than fish, because the fish oils are anti-inflammatory, but when you're talking about beef, pork, and chicken, those types of saturated fats are extremely inflammatory. And in lupus patients, there was some good studies done, and we'll talk about it. When you eliminate those particularly from the diet, the severity of the symptoms reduced. So truly, I know a lot of people may not want to hear this, but a vegetarian diet for someone who has lupus is kind of a must. If you do chicken, make sure it is chicken breast, so it's extremely lean. When we're talking about being able to eliminate as well too, we need to drink a lot of water. Every 2 hours, everybody should be drinking 8 ounces of water every 2 hours, because they tell us that we need 64 ounces of water. And I think most people don't get it. On good days I will, on most days, sometimes I only get half that. So make a conscious effort if you suffer from lupus or are healthy to get more water. Now, there are certain foods that are very rich in sulfur that have an affinity to help give some protection of the joints. And that includes onions, garlic, and asparagus. I know most people are like, asparagus, it makes me smell. Well, it is probably one of the highest sulfur-containing vegetables in addition to onions and garlic that you can do. And it's very alkaline cleansing for the body. When you're talking about, and we discussed a little earlier, about bowel inflammation and how when your bowel isn't operating right, 80% of your immune system is right down in here. You've got to eliminate the foods that you're allergic to. And having one of those good blood works with the 99 food panel to determine what you're allergic to is pretty paramount in anybody who suffers from autoimmune disorders or eczema or psoriasis or any of that type of those types of disorders, in order to reduce that inflammation down. If you don't do that, you're missing a key element in trying to reduce inflammatory response. Supplements are many, but I wrote the ones down that had the best research and the most hope for reducing symptoms. There was a pretty phenomenal study done on fish oil. Now, mind you, we're talking clean, cold water fish oil sources, not from your local department store or grocery store. We need a good, clean, mercury, PCP, contaminant-free fish oil, a tablespoon to 2 tablespoons per day. In the study, double-blind placebo, 78% of the lupus sufferers sustained significant reduction in symptoms over a 12-week period of time with taking this amount of fish oil. GLA, which this means about 2,800 milligrams of GLA. It's a type of fatty acid that we'll find in nuts. We'll find it in borage oil, evening primrose oil. What it does is it helps with hormonal stability, which we believe is a contributing factor for lupus. And in addition to it, also helps reduce inflammation in combination with fish oil. These are an excellent combination for inflammation. Beta-1,3-glucan, 500 milligrams a day. It better allows the body to identify friend from foe, whether it's lupus or other things. I take it because everybody walks into my store with measles, whooping cough, you name it, flus, every infection known to man, pneumonia, and I don't catch it. I supplement very well, but one of the key things I think that I have found works very well in the research supports is the beta-1,3-glucan. Once again, when autoimmune disorders, your body has a difficult time identifying friend from foe, the beta-glucan can aid and abet your ability to identify friend from foe. DHEA, there's some clinical studies, I believe out of the Mayo Clinic, and I know this seems like a high dosage for women, but 50 to 200 milligrams under the supervision of a doctor, because DHEA is a precursor to estrogens, progesterone, testosterone, and so apparently oftentimes people who have lupus have a difficult time with converting DHEA into these forms, so high dosages are necessary. MSM. Now, I know most people think, oh my God, I've got to take 2 to 8 of those 1,000 milligram pills per day. Yeah, do it up until the point of you get loose stools, because that MSM, those sulfur compounds that we talked about earlier, really help, based upon clinical data, with lupus, particularly in systemic lupus that attacks the joints. A reduction of inflammation and better usage of the collagen. Now, I don't have it down here, but your vitamin C is very important for your immunal response and your collagen matrix as well, too. So that in conjunction with MSM is very helpful. Digestive enzymes. People who have lupus have problems breaking down and absorbing a lot of their nutrients. And enzymes can help pre-digest, break down the food so that the intestinal tract can better absorb them. In addition, they're very anti-inflammatory and ease up on the stress on the body, particularly on the liver and the pancreatic gallbladder, in production of enzymes. Turmeric, double-blind placebos on turmeric, and I know even Dr. Rosenfeld on Fox News has mentioned that 500 milligrams of turmeric extract, mind you, not the spice, but the extract, twice a day wasn't as nearly as effective anti-inflammatory as your typical Mobix or Celebrex, which we now know contributes majorly to heart valve, the eating up of them. One of my customers came in today, and she was taking ibuprofen for the last 6 months straight, and she had an ultrasound a year ago and had another one. Her heart valve is now gone from a small leak to critical. So ibuprofen, all the anti-inflammatories like that eat heart valves. Super greens, chlorella, spirulina, they alkalize the blood, bolster the immune system, help you better, your body better respond to viruses and bacteria that may attack it. Good bacteria, similar in that way. Remember I said 80% of your immune is in your bowel? Well, these good bacteria, once again, aid in abet you being able to identify friend from foe. They also help the body to be able to eliminate toxins and overwhelm when you do eat something wrong to prevent some of the food poisonings. Vitamin E was found to help with hormonal stabilization and lupus symptoms, particularly in the skin response to lupus. There are some homeopathics that can help relieve symptoms. We have to be very specific, though, as far as emotional state and all of that. Good books will help you differentiate the different homeopathics that can bring about some relief. Next, we're going to be moving on to a special section of our show where we're going to be talking about some options for you as far as detoxing food. Thank you. Welcome to the special segment on nutrition. You know, I want to point out to you that it's very, very important that you know where to get your foods from and who the foods are coming from. Recently there were some reports on some what are called organic baby foods that when they tested them came out with very high cadmium and lead levels. Not knowing where a lot of these particular national companies get their food from, it makes you wonder if it isn't coming out of China or some other place where truly we can't guarantee they're organic. So it's very important when you're making things like kale salad like we do at our store that you know where your food is coming from. I know for me, my store, I order all California sources. There's a few things that come out of Washington, but the United States sources are the best, so know your sources of food so that when you make your nice little kale salad with cabbage, kale, carrots, onions, olive oil, and a little balsamic vinegar, salt and pepper, yummy, alkalize the blood, falls within that classification of what we were talking about as far as lupus is concerned. You'll know that your food is actually going to alkali your blood and isn't going to be full of chemicals. So, know your source, know your food. Thank you. And next we're going to be moving on to the research portion of our show. Hi, welcome back to the Fit and Healthy Show. And with us today is Ralph Turchiano, the research portion of our show.
Thank you very much for that intro. And how would you like to guess what is the #1 most prescribed drug currently in the United States? #1. And what is it? Is it cholesterol-lowering medications, high blood pressure medications, antidepressants? And also qualifies now for the #2 cause of all accidental deaths in the United States. Well, maybe if you remind me in 9 minutes, you'll find out. Let's start off first, though, with an article published in the Journal of Food Research in regards to aphrodisiacs and spicing up your love life. What they discovered and this is a published article, is that basically a lot of the prescription drugs which are out there have their nasty side effects. So they may get one job done at the price of causing another one, such as muscle pain, headaches, blurred vision, interactions with other medications. Well, what appeared in the Journal of Food Research International was that 3 things did come out to have strong efficacy as far as things that help with sexual function. The 3 were actually Panax ginseng. Remember, there's many different varieties of Panax ginseng. Second was saffron, of all things, which surprised me too. Then also, third was yohimbe bark, which has been the physician's desk reference for a long time, known as yohimbine hydrochloride. Those 3 were shown to have significant data backing up their claims to help improve sexual function. The other ones that came in a good second, which we know work with animals but not yet with humans, are nutmeg, clove, garlic, which has the obvious drawbacks, ginger, and a substance called ambergris, which is found from the sperm whale. Alcohol was also shown to increase sexual arousal, but limited performance. So keep that in mind. All right, now we go down to another muscle we may want to preserve, and that's called the heart. All right, this came out of the American College of Cardiology in New Orleans. What they discovered was this. They took 65-year-olds who exercised for over 25 years on a regular basis. It's 5 days a week of actual exercise itself for 25 years. When they looked at their hearts not only did not deteriorate, they had extra muscle built up upon them. So much so that these 65-plus group of exercises had hearts which were better shape than your typical 25 to 34-year-old sedentary adult. So that's going to rewrite what we think about age, at least when it comes to cardiovascular. If you don't use it, you will lose it, and you'll lose it pretty darn fast. But keep in mind, if you start exercising at the age of 40, plus 25, that's 65, you could be in the exact same shape these guys are in. So again, that was in the American College of Cardiology. The heart did not age. It actually improved and outsurpassed the younger peers. Now, talk about the old terrorist stuff we haven't talked about for a long time. And many of you may recognize this as a favorite assassin's weapon of the Cold War. Well, it's an easy way to get rid of it. And this substance, obviously derived from castor bean oil, was also known as ricin. Also a major concern being used as a terrorist weapon. Well, they found one simple thing that deactivated ricin fairly readily on most surfaces. And this was from the meeting of the exposition of the American Chemical Society. What they said was basically household bleach. So, if you got a lot of that Cold War paranoia, a little bit concerned about your neighbor, something to think about if you're concerned about this thing breaking out. Household bleach turned out to be the most effective anti-ricin agent. Bleach significantly reduced the toxicity of ricin within 5 minutes. Or I should say, bleach completely eliminated ricin in the control samples using just a small amount, which is not so bad. Today you hear about things like polonium and other radioactive substances, which ironically are in most of your cigarettes, because your cigarettes are one of your highest sources of radioactive exposure. Something for you to check out on your own. Now we go to cancer. They discovered when they added oxygen treatment, or oxygen at 2.5 times the normal pressure, to a substance called wormwood. Otherwise, an extract of wormwood is known as artemisia. That basically, it significantly stopped cancer. This was reported in the Journal of Anti-Cancer Research. In a new study using artemisian or high-pressure oxygen alone in a culture of human leukemia cells, it reduced the cancer cell growth by 15%. In combination with the oxygen, it reduced the growth as much as 38%, effectively increasing the artemisia's effect on leukemia by 50%. And this was only done after 48 hours. It wasn't a long study, just 2 days. What they said was simply this. Artemisian is a promising low-cost cancer treatment because it's specific, it's cheap, and you don't have to inject it. The researcher said it's 100 times more specific than traditional chemotherapy. In breast cancer, it's even better. Something simple and out there, and you don't have to inject it, and it's readily available. They'll be curious if this is part of your health care plan or health care program in the near future, if they actually bother to research and actually use something that has a very low incidence of side effects. But it beats the chemo drugs, and I guarantee it's 100 times more effective, it's 1,000 times cheaper. Now we go to obesity, something that comes in regards to tangerines. Well, they discovered a very interesting flavonoid or substance in tangerines called nobiletin, and this was published in the Journal of Diabetes. They took 2 groups of mice, and basically what they did is this. They fed the exact same diet, the mice, the Western diet, with nobiletin, and experienced no elevation in their cholesterol, triglycerides, insulin, or glucose, and gained weight normally. And being by Western diet, I mean fat and sugar. Mice became much more sensitive to the effect of insulin. Nobiletin was shown to prevent the buildup of fat in the liver by stimulating the expression of genes involved in burning excess fat and inhibiting the genes responsible for manufacturing fat. This was nobiletin from tangerines. They said, quote unquote, nobiletin treated mice were basically protected from obesity. Protected. And in longer term studies, It stopped the buildup of plaque in the arteries. Again, published in the Journal of Diabetes, simple substance from tangerines, nobiletin. Either go for your tangerines or start looking for a supplement like this in the near future, because it's pretty darn promising if anything else is out there. Now, we go to basically MRSA. A lot of us are concerned about MRSA and how do you fight MRSA. Well, they did a real interesting live global broadcast on something that kills MRSA very effectively. What they discovered, this was for World Health Day, what they did under a state-of-the-art fluorescent microscopy is show that copper eradicated an exceptionally high challenge of MRSA bacteria. Worldwide, microbiologists and clinicians assess the effects of bacteria from MRSA rapidly dissolving and dying on copper, yet surviving completely on stainless steel, which is used in a lot of medical instruments. They said copper is a powerful antimicrobial, which quickly and continuously reduces the number of bacteria on its surface. We demonstrated it here in the lab, and it's also been shown to be effective in a busy clinical environments as part of a set of infection control procedures. They said changing common touch surfaces in hospitals to copper can break the chain of infection, which is something real interesting when you start seeing a lot of your surgical instruments just do something simple to change to copper. That can save a lot of problems, including, in fact, on top of that, whether you have copper skin creams, things along those lines, which seem to have a tremendous impact in stopping MRSA. That's the second or third thing we found out that was very effective against MRSA outside of antibiotics. Your L-Compane, your copper, and your silver. Yet, almost none of these, except maybe silver, that be used now in Band-Aids and things like that, have been incorporated in a hospital setting. Millions of people die from a simple fix. And now we go back to the quiz question. What is now the #1 most prescribed drug in the United States above high blood pressure, cholesterol medications, antipsychotics, antidepressants, and everything else that's out there, including your cough medicine? Well, your #1 prescribed drug is opiates. Yes, opiates now surpass everything as far as your hydrocodone or oxycodone, which account for 85% of the opiates out there that are prescribed. In fact, opiates are so common, 1 in 4 18 to 25-year-olds will abuse opiates. 1 in 4, for obvious reasons. We don't have to tell you why. And now, they also said too, and there's another side note so I don't go off too far track, 12% of your children are now prescribed opiates on top of that. But opiates are now the second leading cause of accidental death in the United States, and prevalent only second to marijuana as far as its use. Well, thank you very much for the intro, and something to keep an eye out for.
Thank you very much, Ralph. Once again, take your health into your own hands when it comes to diagnosis, finding a good diet, and doing your research. Thank you again for joining our show.